Hi, this is Dr. Paul with Car Injury Care TV, and it's the internet show that answers the most common medical legal questions regarding automobile accidents. And our guest today is Dr. Greg Hollstrom. He's a chiropractor, board certified neurologist chiropractor in Largo, Florida. And the question we're talking about today is, how does cost work when you're in an automobile accident? What are the fees, charges, and costs? So that's the question, Dr. Hollstrom, and I'm sure you get that question from patients frequently, would you not?
Yes, that's a common concern of a lot of people who have been hurt in an auto accident. And the answer to that is, in the state of Florida, you're required to purchase auto insurance, and this auto insurance has a medical benefit. And generally the medical benefit is for $10,000 of medical care, and generally they're covered on what's called an 80-20 split. 80-20 meaning they pay 80% of the medical bill, and that it's the patient's responsibility to pay 20%. Some patients will purchase a
rider or something?
A rider. It used to be called med pay, but sometimes they will have coverage for that 20% that isn't coming out of their auto-related benefits.
Mm-hmm. And let's back up for just a second. What happens? So that's state law that you are required to buy that insurance.
That's correct.
That's part, and I guess that's just part of when you buy your insurance for your car, that's part of it then, right?
That's correct.
And those are the bare minimums, right?
That's
correct. I guess you can actually buy more, couldn't you? More insurance that has more coverage or better coverage, or?
I believe that patients, based on what type of premium they want to pay for their auto insurance, can have additional medical benefits.
And so those are the bare minimum qualification, 10,000.
That's correct.
Okay, okay. Now, so when a patient comes in, and does that cover all healthcare providers, like a chiropractor? Does that insurance cover chiropractic?
Absolutely.
Okay. And so when a patient comes in, they would use their insurance for their care, their auto insurance primarily for their care for treatment first, right?
Correct.
Okay. And then you say there's 20% of that bill that is not covered. Is that right?
That's correct.
Okay. And then the typical, how's that 20% paid again? Who pays that 20%?
Well, that 20% is technically the patient's responsibility. However, that med pay option on their insurance can cover it. But there's also something called coordination of benefits, which means that 20% will, if they don't have coverage for their auto insurance, can be billed to their health insurance.
Is that right?
That's correct.
Is that a common practice?
That's a common practice, and we do that for all our patients here at the office.
Okay, okay. And so their major medical insurance will cover their automobile accident, what the automobile coverage did not cover?
That's correct.
Okay. Well, that's good to know. And then, and so if the patient does not have major medical insurance, then they're responsible for the 20%, I take it?
Then they'd be responsible for the 20%. But oftentimes, these patients will come to us who have legal representatives or have hired attorneys, and frequently the attorneys will offer something called a letter of protection.
Mm-hmm. And what is that?
A letter of protection is basically a document or a contract that exists between the doctor, the patient, and the attorney, which basically states that any costs that are incurred above medical coverage, or this 20% if it's not included in their coordination of benefits, will come out of a settlement in the event that there's permanent impairment and a settlement at the end of their
Okay, well that's
injuries.
interesting. So with their insurance, and if they have a, and you called that a letter of intent, is that what you called that?
Letter of protection.
Letter of protection. So with the insurance for the 80% and the letter of protection for the 20%, so essentially the patient shouldn't be responsible for anything financially, is that right?
At the time of service, that's correct.
Okay. Is there any reason that that statement would not be true that I just said?
Well, generally no. In the event that there was no settlement or no permanent impairment, a patient could be responsible for the 20%.
Okay, okay, if there's no permanent. Let's
Or,
go there.
and or if it hadn't been covered by their health insurance.
Right, right,
Which,
right.
Right.
So let's go into if it was over 10,000. What happens to that 20% if the medical bills are over 10,000?
Well, that 20% or the additional monies over 10,000 frequently are handled on a letter of protection. And without a letter of protection, the patient becomes responsible for the payment at the time of service. But with the letter of protection, that is an agreement that the physician will waylay any collection until there is a settlement in the event that there is permanent impairment and a settlement.
I see, I see. So it's important, one, that the patient have insurance. Two is if they have major medical, it's billed to them, and then billed to the major medical for the 20%. And then three is that they have a letter of intent from the attorney. And if all those kind of fall in line, then essentially the patient probably won't be responsible for any cost or fees. Is that right?
That's correct.
Okay, good. And you do all the billing for the patient? Is that right?
Yes, we do. We do all the billing on a weekly basis.
Okay, so they don't have to fool with any of the paperwork at all?
No.
Okay, good. All right, again, this is Dr. Paul with Car Injury Care TV, and we're talking with Dr. Greg Hollstrom, chiropractic board-certified neurologist here in Largo, Florida, and we will see you on the next show. You take care. Bye.